Welcome to this educational program. This program discusses the technique of male self-catheterization. By now, you will have been shown the technique by a nurse. This presentation is meant to be used as a resource to guide you with this skill. It can be viewed as many times as necessary until you are perfectly comfortable doing it. You may use the player on your left to skip through parts or replay certain slides as many times as you wish. The information provided is of a general nature and may not reflect your individual circumstances. If you have specific questions, please contact your doctor or appropriate healthcare professional. Self-catheterization involves passing a small tube, or catheter, into your bladder to empty it completely. Urine will flow through the catheter out of the bladder. It takes practice to perfect this skill and become more comfortable doing it. There are two main reasons why men are asked to learn self-catheterization. Most commonly, it is to assist with bladder emptying. You may have difficulty emptying your bladder because of weakness of the bladder muscle or because of obstruction of the urine passage. In such circumstances, bladder emptying is impaired, and this can lead to health problems. Self-catheterization not only helps to prevent health problems such as bladder infections, bladder stones, and kidney damage, but it also improves one's lifestyle by reducing urine leakage, or incontinence. The second most common reason that a man may need to self-catheterize is to keep scar tissue from reforming and blocking urine flow out of the bladder. Urethral stricture and bladder neck contracture are two terms used to describe the presence of scar tissue in the urine passage, or urethra. Initially, these conditions may require a urologist to stretch open or cut into the scar tissue. After doing this, however, the scar tissue has a tendency to reform and reobstruct the urethra. It is for this reason that your doctor may ask you to periodically pass a catheter through the area to keep the scar tissue from reforming. Before we describe the technique of self-catheterization, let us review some important anatomy. Urine is made in the kidneys and travels down to the bladder where it is stored. Urine leaves the body when we urinate through a long narrow tube called the urethra. The urethra passes through the prostate gland and then through the urinary sphincter or valve muscle before finally traveling through the penis. The opening of the urethra at the tip of the penis is called the urethral meatus. Normally, when we have a full bladder and an urge to urinate, the brain sends a message to the sphincter muscle to relax, and this allows the bladder to contract and empty. Once emptying is complete, the sphincter muscle tightens up again and closes, and the bladder relaxes and starts to fill again. In preparing to do self-catheterization, you will need the following supplies. Firstly, you will need catheters. There are many different kinds of catheters, and the size and type will depend on your situation. Some catheters are reusable, while others are for one-time use. Catheters are available at certain pharmacies and medical supply stores. The nurses who first teach you the self-catheterization technique, or your local pharmacist, can point you in the right direction. Next, you will need water-soluble lubricant such as KY jelly. Do not use petroleum jelly such as Vaseline. You will also need towels and washcloths for cleaning, and of course, soap and water. Before you start to self-catheterize, be sure to choose a location which is both private and very well lit. Try to empty as much out of your bladder as you can on your own. Finally, your doctor may suggest that you periodically measure the amount of urine you empty on your own and the amount that you empty with the catheter. Now we will walk through the self-catheterization technique step by step. First, wash your hands well with soap and warm water and dry them completely. Next, gather your supplies and lay them out on a clean towel. Squeeze some lubricant onto a clean towel and roll the end of the catheter in the lubricant. Now, pull back the foreskin if you are uncircumcised and wash the end of the penis with warm soap and water. Clean in a circular motion starting at the tip of the penis. Dry the area with a clean towel. Position yourself comfortably, either on the toilet or on a chair facing the toilet. Some patients need to catheterize in a lying down position. In this case, place some padding or a towel under you to protect the bedding. If measuring the amount of urine, position yourself such that the catheter drains into a measuring container. If not, position yourself so that the urine drains into the toilet. Now, hold the penis straight up with one hand and gently insert the catheter with your dominant hand into the urethra. Continue to slowly advance the catheter until you feel some resistance. This is the sphincter muscle. It is important now to pause here for a few seconds to allow the sphincter to relax. Next, while breathing easily, slowly advance the catheter through this area. Hold the catheter in place over the toilet or container and allow the bladder to empty completely. The flow out of the catheter may be slow, so be patient while it empties. You may need to push down over the bladder or cough to assist with the last small amount. Now, slowly remove the catheter, pausing briefly anytime some more urine comes out. If you are uncircumcised, replace the foreskin back over the head of the penis. This is very important. Wipe yourself dry and get dressed. Measure and record the urine volume if required by your doctor, and finally, of course, wash your hands. If you are using reusable catheters, keep these tips in mind. Clean the catheter after each use by rinsing it under tap water immediately after use, then washing it inside and out with warm running water and liquid soap. Scrub the outside. Rinse the catheter completely and shake it to dry. Then air dry it on a clean towel. Once it is dry, store it in a clean Ziploc bag. Reusable catheters should be changed every 1 to 3 weeks, or if it becomes gritty, if it gets torn, or if frequent bladder infections are occurring. Is self-catheterization safe? In a word, yes. Many patients are concerned about the possibility of bladder infections from self-catheterization. Indeed, if tested, the urine will show some bacteria, or germs, which come from the skin. However, the chance of a true significant bladder infection is really quite low. So how often should you catheterize? Your doctor or nurse will suggest a schedule to you. In general, if your problem is poor bladder emptying, then it is recommended to catheterize every 4 to 6 hours. If your problem is scarring in the urethra, then you may be asked to catheterize once a day to once a week. Keep these precautions in mind when self-catheterizing. If you drop a catheter, start over with a clean one. When resistance is felt on inserting the catheter, do not force the catheter in. Call your doctor if you develop any of the following: signs of infection, such as chills, fever, a temperature above 38 degrees Celsius, cloudy or foul-smelling urine, or a sudden onset of urine leakage. Also call your doctor if you experience persistent blood in the urine, or if you have difficulties passing the catheter into your bladder. This concludes our presentation on male self-catheterization. These references were used in the preparation of this module and/or can be used to assist you if you require further information. We sincerely hope that this module has furthered your understanding of the male self-catheterization technique. Thank you again for viewing this educational program.